Free NCSBN-NCLEX questions PDF download with answers full test. Question 1. A 6-month-old infant is being treated for developmental hip dysplasia and has been placed in a hip spica-plaster cast. Which discharge information is important for the nurse to reinforce with the parents? Option A. Turn the baby every 2 hours using the abduction stabilizer bar. Option B. Check frequently for swelling in the baby's feet. Option C. Gently rub the skin with a cotton swab to relieve itching. Option D. Place favorite books and push-pull toys in the crib. The correct answer is option B. Check frequently for swelling in the baby's feet. 2. Question 2. A nurse is talking to parents about the side effects of routine immunizations. Which finding should the nurse reinforce about calling the healthcare provider if it occurs within 24 to 48 hours after a routine immunization? Option A. Localized tenderness at the injection site. Option B. Tympanic temperature of 104 F, 40 C. Option C. Some irritability and fussiness. Option D. Swelling at the injection site. The correct answer is option B. Tympanic temperature of 104 F, 40 C. 2. Question 3. A client exhibits many delusional thoughts. As the nurse assists the client to prepare for breakfast, the client comments, "Don't waste good food on me. I'm dying from this disease I have." Which response by the nurse would be the best? Option A. None of the laboratory reports show that you have any physical disease. Option B. Try to eat a little bit. Breakfast is the most important meal of the day. Option C. I know you believe that you have an incurable disease. Option D. What has your primary healthcare provider told you? The correct answer is option C. I know you believe that you have an incurable disease. 3. Question 4. The family member tells an admitting nurse that the client values the practice of Chinese medicine. The nurse must understand that for this family and client a priority goal should take which focus? Option A. Achieve harmony. Option B. Respect life in old age. Option C. Maintain energy balance. Option D. Restore yin and yang. The correct answer is option D. Restore yin and yang. 4. Question 5. The nurse is reinforcing dietary instructions to the parents of a child diagnosed with cystic fibrosis. The nurse will emphasize which of the following characteristics of this diet. Option A. A gluten-free diet, avoiding foods that contain wheat, rye and barley. Option B. Balanced, high-calorie diet with extra fat, salt, protein and calcium. Option C. Foods low in sodium, potassium and phosphorus. Option D. Carbohydrate counting, selecting foods from the bread/starch, fruit, or milk group. The correct answer is option B. Balanced, high-calorie diet with extra fat, salt, protein and calcium. 2. Question 6. The nurse works in a psychiatric inpatient setting. What information should the nurse be aware of as one of the most frequent reasons for suicide in adolescents? Option A. Progressive failure to adapt to peer pressure. Option B. Reunion wish or a fantasy of some sort. Option C. Feelings of anger or hostility toward others. Option D. Feelings of alienation or isolation from peers. The correct answer is option D. Feelings of alienation or isolation from peers. 4. Question 7. When a client returns from surgery after an open reduction with cast application for a femur fracture, a small blood stain is noted on the cast by the nurse. 4 hours later, the nurse observes that the stain has doubled in size. What is the initial action for the nurse to take at this time? Option A. Ask the family members to call you when they notice the spot getting larger. Option B. Record the findings in the nurse's notes. Option C. Outline the spot with a pen and note the time and date on the cast. Option D. Report the finding to the registered nurse, RN, charge nurse. The correct answer is option C. Outline the spot with a pen and note the time and date on the cast. 3. Question 8. The nurse is discussing an illness with a 10-year-old child. What should the nurse keep in mind about this child's ability to understand the information at this stage of development? Option A. Makes simple association of ideas. Option B. Bases conclusions on abstract thinking. Option C. Interprets events from own perspective. Option D. Thinks logically to organize facts. The correct answer is option D. Thinks logically to organize facts. 4. Question 9. The nurse calls for help after finding an unresponsive adult client in a hospital room. What action should the nurse take next for the client who has no pulse and is not breathing? Option A. Open the airway and deliver 2 breaths followed by 30 compressions. Option B. Provide continuous chest compressions until someone comes with the crash cart. Option C, provide a cycle of 30 compressions followed by 2 breaths. Option D, provide 15 compressions and then pause while someone delivers 1 breath using an ambi bag. The correct answer is option C, provide a cycle of 30 compressions followed by 2 breaths. 3. Question 10. A nurse is discussing with a group of parents when they can begin teaching their preschool children about injury prevention. Which approach should the nurse reinforce? Option A, discuss the consequences of not wearing protective devices. Option B, protect their preschooler from outside influences. Option C, set good examples themselves through their actions. Option D, make sure their preschooler understands all the safety rules. The correct answer is option C, set good examples themselves through their actions. 3. Question 11. The nurse is caring for a post-mature infant in the newborn nursery. What factor should the nurse recognize as being the primary reason associated with complications of being post-term? Option A, depletion of subcutaneous fat. Option B, progressive placental insufficiency. Option C, excessive fetal weight. Option D, low blood sugar levels. The correct answer is option B, progressive placental insufficiency. 2. Question 12. The registered nurse, RN, has initiated the administration of an intravenous vesicant chemotherapeutic agent to a client. Which finding during the care by a practical nurse, PN, would require the PN to immediately notify the RN? Option A, a rash on the client's extremities. Option B, complaints of pain at the infusion site. Option C, stomatitis lesions in the mouth. Option D, severe nausea and vomiting. The correct answer is option B, complaints of pain at the infusion site. 2. Question 13. A client with testicular cancer has had a unilateral orchiectomy. Prior to discharge, the client expresses his fears related to the prognosis. Which statement should be the initial response by a nurse? Option A, self-examination needs to be continued in order to prevent and detect recurrences. Option B, chemotherapy is most likely to be started right away. Option C, adoption may be a consideration if you want children. Option D, testicular cancer has a very high cure rate with early diagnosis and treatment. The correct answer is option D, testicular cancer has a very high cure rate with early diagnosis and treatment. 4. Question 14. A nurse is caring for a child who has been recently diagnosed with cystic fibrosis. Which finding should the nurse anticipate? Option A, dry, non-productive cough. Option B, poor appetite. Option C, frequent urinary infections. Option D, ribbon-like stools. The correct answer is option A, dry, non-productive cough. 1. Question 15. The nurse is caring for a client who is diagnosed with chronic renal failure with hemodialysis 3 times per week. The client becomes confused and irritable 6 hours before the next treatment. Which of these findings might explain the reason for the client's behavior? Option A, low potassium level. Option B, elevated blood urea nitrogen, BUN. Option C, low calcium level. Option D, metabolic alkalosis. The correct answer is option B, elevated blood urea nitrogen, BUN. 2. Question 16. A client with a fracture of the radius had a plaster cast applied 2 days ago. The client calls the clinic to report constant pain and swelling of the fingers since the cast was applied. What should be the next action of a nurse? Option A, suggest to elevate the arm higher than heart level. Option B, ask if numbness is present in the fingers and if the client can move the fingers. Option C, have the client make an appointment with the surgeon for the next day. Option D, approve the application of a cool cloth to the fingers of the affected arm. The correct answer is option B, ask if numbness is present in the fingers and if the client can move the fingers. 2. Question 17. The client is seen in the emergency one day after falling in his bathroom at home. The client reports having a few drinks prior to the fall. Which finding requires the nurse's immediate attention? Option A, bruise behind one ear. Option B, blurred vision. Option C, nausea and vomiting. Option D, headache. The correct answer is option A, bruise behind one ear. 1. Question 18. Diagnosed with heart failure, the client had an implantable cardioverter defibrillator, ICD, implanted several years ago. The client now has end-stage heart failure and is receiving home hospice care. Which end-of-life care option could have the greatest impact on client comfort? Option A, encouraging the client to sit upright in bed. Option B, confirming advanced directives and plans for resuscitation. Option C, deactivating the implantable cardioverter defibrillator, ICD. Option D, assisting the client to eat several small meals. The correct answer is option C, deactivating the implantable cardioverter defibrillator, ICD. 3.